Over 60, if your legs feel cold, heavy, numb, or painful, your body may already be warning you about dangerous circulation problems. Many people ignore these signs, thinking they're just part of aging, but poor blood flow in your legs and feet can quietly lead to nerve damage, slow wound healing, and even amputation in severe cases. The scariest part is that circulation problems often start silently, without chest pain or obvious symptoms. In this video, you'll discover 7 circulation warning signs in your legs and feet that doctors say you should never ignore after 60. One of these signs may already be happening to you right now. Let's start with something important. Most circulation problems don't begin in the heart. They begin quietly in the legs and feet. As we get older, blood vessels naturally become less flexible. Blood flow slows down, especially to areas far from the heart. That's why your legs and feet are often the first places where circulation problems appear. Many people over 60 ignore early signs because they seem minor. Cold feet, mild swelling, occasional numbness, a little pain when walking. These symptoms are often blamed on aging, fatigue, or lack of exercise. But poor circulation is not just a comfort issue. When blood flow is reduced, oxygen and nutrients cannot reach tissues properly. Over time, this can damage nerves, weaken muscles, slow healing, and increase the risk of serious complications. The danger is that circulation problems often progress silently. You may not feel chest pain or shortness of breath. Instead, your body sends subtle signals through your legs and feet, signals that are easy to miss. Conditions like diabetes, high blood pressure, and high cholesterol, very common after 60, can further damage blood vessels. Smoking history, lack of movement, and dehydration also make circulation worse. This video is for educational purposes only and does not replace medical advice. The goal is awareness. Recognizing early warning signs gives you the chance to act before serious damage occurs. In this video, we'll cover 7 circulation warning signs in your legs and feet. Some are obvious, others are surprisingly subtle. If you notice even one of these signs regularly, it may be time to pay closer attention to your circulation health. Let's begin with warning sign number 1, a symptom many people feel every day, especially at night, and almost always ignore. Cold feet and toes are one of the earliest and most common warning signs of poor circulation in people over 60. Many people experience this symptom daily, especially in the evening or at night, and dismiss it as a normal part of aging. However, cold feet often mean that blood is not reaching the lower extremities efficiently. When circulation slows, the body prioritizes blood flow to vital organs like the heart and brain. As a result, the legs and feet receive less warm, oxygen-rich blood. Poor circulation can be caused by narrowed or hardened blood vessels. Over time, plaque buildup, high blood pressure, and inflammation reduce the ability of blood vessels to expand and contract. This makes it harder for blood to travel all the way to the feet. Cold feet may be worse when resting or lying down. At night, blood pressure drops naturally, further reducing blood flow to the lower limbs. This is why many people notice cold toes when trying to sleep. Another concern is that cold feet may signal early peripheral artery disease, or PAD. PAD occurs when arteries supplying blood to the legs become narrowed. If left untreated, it can lead to pain, ulcers, and serious complications. Ask yourself, do your feet feel cold even in warm rooms? Do you need extra socks or blankets at night? Do your feet feel colder than the rest of your body? If you answered yes, circulation may be compromised. Cold feet can also increase the risk of nerve problems. Nerves need a steady supply of oxygen and nutrients. Reduced blood flow can damage nerve fibers, leading to numbness or tingling over time. The danger is that cold feet are often painless. Because there is no sharp pain, people ignore the symptom for years while circulation continues to decline. Simple steps such as staying hydrated, moving your legs regularly, and keeping feet warm can help support circulation. However, persistent cold feet should not be ignored. If cold feet occur frequently or are accompanied by color changes, pain, or numbness, it may be time to consult a healthcare professional. Next, we'll look at warning sign number 2, a symptom that often appears after sitting or standing for long periods and can indicate worsening circulation in the legs. Swelling in the legs, ankles, or feet is another common warning sign of poor circulation after the age of 60. Many people notice this swelling at the end of the day and assume it's just from standing too long or getting older. However, persistent swelling can signal that blood is not circulating properly. When circulation is healthy, blood flows smoothly back to the heart. When circulation slows, blood and fluid can pool in the lower legs due to gravity. This causes pressure to build up, forcing fluid to leak into surrounding tissues, leading to swelling. Swelling is often worse after sitting or standing for long periods. Long car rides, flights, or hours spent sitting can reduce muscle movement in the legs, which normally helps push blood upward. Without this movement, circulation slows further. Poor circulation-related swelling may feel tight, heavy, or uncomfortable. Shoes may feel tighter, and socks may leave deep marks around the ankles. Some people notice that swelling improves overnight but returns the next day. Another concern is that swelling can increase the risk of skin damage. When tissues are swollen, the skin becomes stretched and fragile. This makes it easier for cuts or sores to develop and harder for wounds to heal. Swelling may also be linked to conditions such as chronic venous insufficiency, where veins struggle to return blood to the heart. Over time, this can lead to skin discoloration, pain, and ulcers in the lower legs. Ask yourself, do your ankles or feet swell by the evening? Do your shoes feel tighter later in the day? Do you notice deep sock marks around your ankles? If you answered yes, circulation issues may be developing. Swelling should never be ignored if it is persistent, painful, or accompanied by skin changes. In some cases, it may also be related to heart or kidney problems, which can worsen circulation. Simple steps such as elevating your legs, staying active, and avoiding long periods of sitting can help reduce swelling. Wearing supportive footwear and moving your legs regularly can also support blood flow. If swelling continues or worsens, it is important to seek medical advice to identify the underlying cause. Next, we'll discuss warning sign number 3, a symptom that often appears when walking and can be an early sign of serious circulation problems. Pain or cramping in the legs while walking is a classic warning sign of poor circulation that many people over 60 ignore. This pain often appears after walking a short distance and improves with rest, leading people to believe it's just muscle fatigue or aging. In reality, this symptom may be intermittent claudication, a condition caused by reduced blood flow to the leg muscles. When you walk, your muscles need more oxygen. If narrowed arteries cannot deliver enough blood, pain or cramping occurs. This pain usually affects the calves, but can also appear in the thighs, hips, or buttocks. It may feel like tightness, aching, or burning. The discomfort often disappears after resting for a few minutes, which makes it easy to dismiss. Poor circulation-related leg pain is a warning that blood vessels are becoming narrowed or blocked. Over time, this can progress and lead to more severe pain, even at rest. In advanced cases, it can increase the risk of ulcers, infections, and tissue damage. Ask yourself, do your legs hurt or cramp after walking short distances? Does the pain improve when you stop and rest? Do you avoid walking because of leg discomfort? If you answered yes, circulation problems may already be present. This type of pain is more common in people with diabetes, high blood pressure, high cholesterol, or a history of smoking. These conditions damage blood vessels and reduce blood flow to the legs. Ignoring leg pain while walking can be dangerous. It is one of the strongest early signs of peripheral artery disease. Early detection allows for lifestyle changes and medical treatment that can slow progression and reduce complications. Staying active, managing blood pressure and blood sugar, and avoiding smoking can help improve circulation. However, persistent leg pain should always be evaluated by a healthcare professional. Next, we'll look at warning sign number 4, a symptom related to skin and color changes in the legs and feet often overlooked but important. Changes in skin color or texture in the legs and feet can be an important warning sign of poor circulation after the age of 60. These changes often develop slowly, making them easy to overlook. When blood flow is reduced, the skin does not receive enough oxygen and nutrients. This can cause the skin to appear pale, bluish, or purplish. In some cases, the skin may look shiny or thin. Another common change is dry, flaky skin. Poor circulation reduces oil and moisture delivery to the skin, leading to dryness and cracking. Cracked skin increases the risk of infection, especially in older adults. Some people notice darker discoloration around the ankles or lower legs. This can be a sign of chronic venous insufficiency, where blood pools in the veins and damages surrounding tissue. Skin may also feel cooler to the touch compared to other areas of the body. This temperature difference is another indication that blood flow is not reaching the skin properly. Ask yourself, do your legs or feet look pale, blue, or darker than usual? Does the skin appear shiny, thin, or unusually dry? Are there color differences between your legs and the rest of your body? If you answered yes, circulation problems may be affecting your skin. These changes are not just cosmetic. Poor circulation weakens the skin's ability to heal. Small cuts or scratches may take much longer to heal and can develop into serious infections if ignored. Skin changes combined with swelling, pain, or numbness increase the risk of ulcers and tissue damage. This is why early recognition is critical. Simple steps such as moisturizing the skin, staying hydrated, and keeping the legs active can help support skin health. However, persistent color or texture changes should be evaluated by a healthcare professional. Next, we'll discuss warning sign number 5, a symptom related to sensation in the legs and feet that often develops quietly over time. Numbness or tingling in the legs and feet is another serious warning sign of poor circulation that many people over 60 overlook. This sensation may feel like pins and needles, burning, or a loss of feeling, and it often comes and goes at first. When blood circulation is reduced, nerves do not receive enough oxygen and nutrients. Over time, this lack of nourishment can damage nerve fibers, leading to numbness or tingling sensations. Many people assume numbness is caused only by nerve problems or aging. However, poor circulation is a major contributor. Without proper blood flow, nerves cannot function normally. Numbness often starts in the toes and gradually spreads upward. Some people notice it more at night or after sitting for long periods. Others feel it when walking or standing. This symptom is especially common in people with diabetes. High blood sugar damages both blood vessels and nerves, making numbness more likely. However, even people without diabetes can experience numbness due to circulation problems. Ask yourself, do you feel tingling or pins and needles in your feet? Do parts of your feet feel numb or less sensitive? Do you sometimes not notice small cuts or injuries? If you answered yes, circulation-related nerve damage may be developing. Numbness increases the risk of injury. Without proper sensation, you may not feel blisters, cuts, or pressure points. These small injuries can worsen quickly when circulation is poor, leading to infections or ulcers. The danger is that nerve damage is often gradual and painless. By the time numbness becomes constant, circulation may already be significantly reduced. Improving circulation through gentle movement, stretching, and staying hydrated can help support nerve health. Wearing well-fitted shoes and checking your feet daily can also reduce the risk of unnoticed injuries. Persistent numbness or tingling should never be ignored. It is important to seek medical advice to determine whether circulation problems or nerve damage are the underlying cause. Next, we'll move on to warning sign number 6, a symptom related to slow healing that can signal serious circulation problems in the legs and feet. Slow healing cuts, sores, or wounds on the legs and feet are one of the most dangerous warning signs of poor circulation after the age of 60. Many people do not realize how serious this symptom is until complications appear. Healthy circulation delivers oxygen, nutrients, and immune cells to help wounds heal. When blood flow is reduced, this healing process slows dramatically. Even small cuts, blisters, or scratches can take weeks or longer to heal. Poor circulation also means fewer infection-fighting cells reach the wound. This increases the risk of infection, which can quickly become serious in older adults. What starts as a minor sore can develop into an ulcer if ignored. People with diabetes are especially vulnerable. High blood sugar damages blood vessels and nerves, making wounds harder to notice and slower to heal. However, slow healing can occur even without diabetes if circulation is poor. Ask yourself, do small cuts on your feet take a long time to heal? Do sores reopen after seeming to improve? Do wounds become red, swollen, or painful easily? If you answered yes, circulation problems may already be advanced. Slow healing wounds are a warning that tissues are not receiving enough blood. Over time, this can lead to tissue breakdown. In severe cases, untreated wounds can result in infection spreading to deeper tissues or bone. This is why doctors take foot wounds seriously in older adults. Poor circulation combined with slow healing increases the risk of serious outcomes, including hospitalization and, in extreme cases, amputation. The danger is that slow healing often goes unnoticed until the wound worsens. Many people cover the wound and wait, assuming it will heal on its own. With poor circulation, this delay can be dangerous. Checking your feet daily is essential after 60. Look for cuts, blisters, redness, or sores, even if they don't hurt. Early detection can prevent serious complications. If wounds heal slowly or worsen, seek medical attention promptly. Early treatment can improve outcomes and help preserve circulation and tissue health. Next, we'll discuss warning sign number 7, a subtle symptom that often appears at night and is closely linked to circulation problems in the legs and feet. Restless legs or discomfort in the legs at night is a subtle but important warning sign of poor circulation after the age of 60. Many people experience this symptom while lying in bed and assume it's just restlessness, muscle fatigue, or aging. Poor circulation can worsen at night because blood pressure naturally drops when you lie down. When blood flow is already reduced, this drop can limit oxygen delivery to the legs and feet even further. As a result, discomfort becomes more noticeable at night. This discomfort may feel like aching, throbbing, crawling sensations, or an urge to move the legs constantly. Some people describe it as deep leg discomfort that improves temporarily when they move or walk. When blood flow is insufficient, muscles and nerves become irritated. Nerves send abnormal signals, creating uncomfortable sensations that disturb sleep. Over time, poor sleep can worsen overall health and circulation problems. Ask yourself, do your legs feel uncomfortable mainly at night? Do you feel an urge to move your legs to relieve discomfort? Does leg discomfort interfere with your sleep? If you answered yes, circulation issues may be contributing. Nighttime leg discomfort can also be linked to chronic venous insufficiency, where blood pools in the legs instead of returning efficiently to the heart. This pooling increases pressure in the veins, causing discomfort and restlessness. Ignoring nighttime leg symptoms can allow circulation problems to worsen. Poor sleep also raises inflammation levels and increases the risk of high blood pressure, creating a cycle that further damages blood vessels. Simple habits such as gentle leg movement before bed, staying hydrated, and avoiding long periods of inactivity during the day can help support nighttime circulation. However, persistent symptoms should be discussed with a healthcare professional. Nighttime leg discomfort is not just a sleep issue, it can be a warning sign your circulation needs attention. After the age of 60, circulation problems often develop quietly, especially in the legs and feet. The warning signs may seem small at first: cold feet, swelling, numbness, or mild pain, but together they can signal reduced blood flow that should not be ignored. Poor circulation affects more than comfort. It increases the risk of nerve damage, slow wound healing, infections, and reduced mobility. When blood flow is limited, tissues do not receive the oxygen and nutrients they need to stay healthy. The good news is that recognizing early warning signs gives you the chance to act. Small changes such as staying active, managing blood pressure and blood sugar, staying hydrated, and avoiding smoking can help protect circulation. This video is for educational purposes only and does not replace professional medical advice. If you notice multiple warning signs or worsening symptoms, consult a healthcare professional for proper evaluation. Take circulation symptoms seriously. Your legs and feet often speak first when blood flow is declining. Listening early can help prevent serious complications later. If this video was helpful, consider sharing it with someone over 60 who may benefit from this information. Awareness can make a real difference. Thank you for watching, and take care of your circulation. It supports every step you take.